Hi, everyone. Stephanie again with a patient story with segment two of Ashley's lung cancer story. Ashley, thank you again for taking us through the previous segment with how you got diagnosed and the scans and the waiting and then the actual moment of diagnosis. I think through lots of conversations with so many people, it doesn't matter how many years pass, that moment kind of lives very vividly in the memory, right?
Yes.
Yeah, and so now we're going to focus on the treatment decisions and the testing that was done, and then the actual treatment. So first, to recap, you were diagnosed with stage 4 non-small cell lung cancer at this point. And can you describe again? You said it was because it was everywhere in both lungs.
Yes. The My lungs had they said it was innumerable amount, over 100 small 1 to 3 millimeter or less nodules in both lungs. So I was inoperable from the get-go. Obviously, you can't cut out all those little bitty sections. I wouldn't have any lungs left. So I was at the mercy of therapy at this point.
Okay, makes perfect sense. And before we go into the testing part of it, I know with the decision of where to go for treatment, like you get hit with this diagnosis, it's stage 4 lung cancer, obviously very serious. Did you think about, I know you're not in a major city, so the question would be, do I go to the local cancer center? They may not have specialists there, but it might be more convenient versus do I take time and energy and go somewhere else? So please walk us through that decision.
My doctor initially, the gynecologist that found the nodules in the very beginning, he was in our capital city in Jackson, Mississippi. And so when he asked about sending me to a pulmonary specialist, he said this was his friend, he knew him. And I said, well, would you consider, someone local to me? And he said, well, I would prefer you go see this person. And so that's how it kind of unfolded, is because my doctor initially was already about 90 miles away from me. My mom lives there. And so it just made sense that since all the other doctors were there, that I too stay. Plus, my whole reasoning for choosing doctors in that area is because their equipment is more advanced. They have incredible care within their hospitals. And so it's just a personal preference for me. Locally, we have a cancer center, we have two major hospitals. But for me personally, I just chose to be there because I felt like there was better care there, more cutting edge equipment, like I said. So with now with lung cancer, I think it's very important that I have a facility that I trust, a facility that I know will fight for me because they've proven that they can do that in my diagnosis. And so it was just a personal preference. And like I said, it's about 90 miles away. So it's doable to go and come in a day by car.
Okay, perfect. Thank you for sharing that as well.
Mhm.
It's interesting. Just people have to weigh the decisions. What's the pro and con for them, and make that again decision for themselves. I'd also love to highlight. You were told stage 4 lung cancer. It's non-small cell. But what's incredibly important, of course, and now it's really wonderful with more developments is this targeted therapy, right? Is let's test for biomarkers and see what's going on, what are the mutations, so that we can really tailor this treatment for you. So they were saying you need to go through this genomic testing. Can you talk about what that entailed and what that was like, how long it took to get the results?
At my initial appointment with the oncologist, there was a mountain of paperwork, you had to fill out. He was with me for 2 hours because this was a new world. And so he told me that he was going to send off the tissue and request, well, not send it off, but request for further testing from Mayo Clinic. And he went down the list with all the possible courses of treatment. If I had PD-L1, this is immunotherapy, and this is what it does, and this is how you do it. You know, it doesn't, your hair will be fine, blah, blah, blah. And then if you have ALK, it'll be this. If you have this, EGFR, there's a brand new drug called Tagrisso. It's a targeted therapy, you take it by mouth. Or if you don't have any, then you'll be on traditional chemo infusion. Well, I heard pill, take it by mouth. And I'm like, I want that. It didn't work that way. You know, you don't get to choose it exactly like that. But he, you know, was rattling off all these letters and numbers, and I was just like, what? But the thing that resonated with me was pill and take it at home once a day. And I was like, I can do this. So I had, even though I had no idea about a mutation or a biomarker or whatever, thankfully he did. And he was privy to all of that and knew, okay, we need to figure out, does she have this or that? And I did. I was EGFR T790, and the oral treatment that I got to start targeted that exact mutation. And so I'm like, I have won the lung cancer lottery. If anybody can, you know, find something positive out of this, that I felt like I had overcome the world. I'm like, okay, I'm gonna live, I'm gonna be all right, more runway for me. Where's my pills? Give them to me, you know, because I had seen people sick on infusion therapy, and I was like, I don't want to be. And there are people that are so terribly sick right now that are fighting just to get up out of the bed and feed themselves, to go to the restroom. So I don't take any of it for granted. And I certainly do not brag and say, look at me, I don't have to do all of that, because I know things will change eventually. There will be a resistance. There will be a next treatment. And I'm not gonna get to sit here and be here forever. But I certainly don't take for granted that I was able to take something by walking to my medicine cabinet and swallowing a pill that has kept those cells at bay and has kept my cancer under control.
I can feel your energy through the internet. I mean, honestly, I hear everything you're saying. It's like, first of all, pill, I don't want to sit through the infusion. Ding, ding, ding. Let's do that one. But you had to wait. You had to see if what was
Right.
going on matched that, right? And for you, it did.
My tissue was already at Mayo Clinic from the thoracic surgeon that sent it over. And so I'm not sure who connected with who, but my oncologist was able to ask them to, you know, complete the biomarker testing. And that took, I waited a long time for that. It felt like it was like a couple of weeks. And I was calling, do you have it? I actually went there for blood work shortly after, and he was like, I'm sorry, we don't have it. And so, you know, I'm like harassing him. And so finally he did get it back, and he called me himself. He didn't send his nurse practitioner or a nurse or a secretary. He called me himself and was like, okay, here's what you need. Here's what we're doing. This is the plan. I'm going to send the prescription over to, you know, where do you want it? So I picked CVS specialty, of course. He was like, you can do this, you can do that, or whatever. And so he was like, they can send it to you by mail if that's what you choose. And I'm like, yep, let's do that. And that was the end. And my question was, can I have wine? Can I have wine on this drug? And he's like, oh, so you want to get sloshed now? And I'm like, well, I have permission to do so, right? So we kind of, laughed about that. But he was like, live your life how you would normally live your life. You just have to take a pill every single day. So go do you, and don't worry about restrictions. Do what you feel like doing. And so I was like, oh, yes, I'm going to be okay, But obviously, with that comes side effects and a whole lot of things that I wasn't ready for.
And we'll definitely get into all that because it's a huge part, of course, of going through any treatment. Were there any, just to be clear, so were there, I know this was like a slam dunk, the Tagrisso was approved just then for this specific situation for EGFR positive, for the T790, but was there any other treatment offered? Like, did he say, hey, also you could do this? But
No,
obviously, no, it was just like, let's do
he
this.
said, this is what you need to do.
Yeah. Okay. And so can you describe, I know it's a daily pill, once a day. You said it was 80 milligrams. I think they said you don't even have to take it with food. So what's the schedule like? And then what's the monitoring situation?
So I take my, I started it at 9 o'clock. The very first dose, I took it at 9 o'clock p.m. because in my head, I thought, okay, if I'm going to be sick from this, this is how small minded I am. I was like, at least I will be in bed, you know? I will be able to hopefully sleep it off. And so that was my whole thinking. Um, Around it, but it wasn't like, taking an antibiotic, you feel funny, within an hour, whatever. The side effects stay and come and go. So I still take it at 9 o'clock, but I still have some side effects, even 43 months in on the same drug. I still have new side effects. It's just very weird, very, very strange. But, I'm thankful that I can still take it.
You're saying that you do have side effects or you don't? You do, right? Yes. Okay. So 43 months in, can you describe what these side effects are and also what helps you reduce them or try and avoid a little bit?
I don't want to use the word tired, but I just felt worn down. I felt heavy. It wasn't that I wanted to sleep all the time, but I had very little like ambition, I guess. And if somebody said you can stay in bed all day, I would say okay. So like that kind of leveled out and I'm like, okay, well this must be really working hard in my body, It's like a pregnant lady that's tired. You're growing a human. You're going to be tired. So I thought, okay, this medicine is working. And so my body's trying to get used to it and accept it. And so that kind of leveled out a little bit. And then there were skin rash. I had these little things that looked like little acne bumps all over. You couldn't treat it like acne. If you tried to do that, it like made it worse. So I was able to take an antibiotic to combat that. It only lasted for about six months or so, and so I don't have any skin rash anymore. That kind of leveled out also. Then I had a new symptom of GI flares where there was sometimes nausea, but a lot of upset stomach. And it wasn't necessarily, I'd try to say, well, maybe I can't eat this kind of food or that kind of food. Maybe I don't need this. But, there was no rhyme or reason to it. Imodium became a staple in my purse, in my car, in my office, everywhere. I made a joke at work. If I'm running, don't stop me. I'm sorry, this is a fact of life. This is how it is. I still have the GI flares from time to time, but currently I'm absolutely exhausted. Like it takes all I can some days to move my body. And I don't know if that's a combination of medication, being in the middle of the crisis our world is in right now, staying at home. Um, Maybe it's a little bit of an emotional thing that's, I'm just exhausted. Getting dressed is like a major ordeal, a major task for me. And so the biggest side effect with Tagrisso to date would be fatigue, just overwhelming fatigue. And I try to move. I have an exercise bike. I try to get on it. I go outside. I try to walk. I was like, well, maybe I should go to the gym. I can get a trainer. He or she can show me some light exercises that I can do to get myself stronger. Not trying to be a bodybuilder, but then we have a new uptick in the things that are going on in the world. I won't even say the word. So now I'm like, well, maybe I don't need to go to the gym. And then, some days if I want to just sit or stay in bed, turn on Netflix, turn on some music, and sit in the recliner or lay down, I will. I have to listen to my body. I have found when I don't eat junk that I do feel better. And so I feel like diet does absolutely play a part. I can feel when I'm dehydrated. I love coffee, so I would much rather drink coffee all day than water all day. But I can feel the difference when I do drink water and when I don't. And so, it's like, well, that's easy, but it's really not because when I worked, I could have a bottle of water on my desk all day long, or one of those big things. But when I'm at home, it's like I don't think about it. I don't know, but I can definitely tell a difference, especially when I go and get labs. I don't have a port, so they actually, stick me, and it's a lot harder for them to get a vein when I'm dehydrated and it hurts. And so I'm like, okay, I gotta drink water. I'm going to the doctor. But I have unfortunately noticed a huge difference when I don't drink enough water. And that sounds so crazy, but that often helps to boost energy. I'm not a big supplement person. I know a lot of people rely on supplements. I don't. Every once in a while I have, vitamins and whatnot. Matcha and green tea, they say, is helpful. But, I might drink it today and then not for a month or two and then drink it again. So I'm not consistent with it. There is a holistic clinic over near where my doctor is that does like a natural like infusion, and I so badly want to go, and it's like $150 to do it. Insurance doesn't cover it, but it's all good things. It's supposedly all natural, and it would give you vitamins and minerals that your body needs to help, and it's specifically for cancer patients. And so I so badly want to go and do that. And so I think that would be something good. But then at the same time, I'm like, well, does that have side effects?
Right?
I
You
don't
have
think
to
it
ask
does.
these questions now.
I
The thing
know.
that you take for the side effects will give you more side effects. And so
Right.
the
And
natural
it happens that way sometimes. And so I'm like, I just need to be plugged up to something. Give me all the minerals that I need, the energy that I need. I don't even need to eat anymore. Just hook me up to the energy the energy line and let's go.
I like
But yeah, I have a hard time finding energy lately.
right. Well, I thank you for walking us through all of that, you
I'm
know.
sorry if I'm long-winded.
No, not at all, because I think it's extremely helpful to hear from people, like, what do you experience and what helps you deal with the side effects? Because sometimes you only know after you go through it, right? And so what I'm hearing is, you know, you've had some GI issues. Look, diarrhea is not, I mean, it can be really painful. It can be really like a big impact on the quality of life. And so
Embarrassing.
well, you know, but it's something that with a lot of these treatments happens, you know, whether it's constipation or diarrhea, some people experience both. And it's like, how does that happen? But it does.
Yes.
And it's painful. When I was going through my cancer treatment, I definitely experienced that. And,
Oh yeah.
you know, you just try everything you can. And so for you, Imodium was in your purse, you said. But I'm hearing that a lot of this was fatigue because that's been sort of the longer term issue. And so sometimes you'll drink water. If you can remember, it gives you energy. You try to move around. But what I really love what you said, Ashley, too, was you said, I will. You said, I will when it came to resting, watching Netflix, lying down because you're listening to your body. And that is actually so much more difficult to do, right? Because sometimes as a person dealing with cancer, you're like, I want to move around. Like, I don't want to just be there. But no, sometimes you got to give yourself some grace and understand that your body's working hard.
I actually wrote an article, um, and it was on not feeling guilty when dealing with a, a physical battle, whatever it is, especially cancer. I don't have any children, so I don't understand what that looks like for some. But I feel like as a wife, I have the responsibility of keeping the house clean and having a meal when he gets home from work on the table. And some days I just don't feel like cooking. That's the last thing I want to do. And he understands. He's like, it's no problem. We'll pick up something or whatever. And so I just had, basically try to convey to people, don't feel guilty for the things you don't feel like doing. You're not the same person. Your body, it has changed. I take that back. You are the same person, but you're different. There's a new thing in your body that's changing and affects people differently. Some folks still work full time. Some, you would never know anything. But I was a tired person before, and I'm really tired now. So I think it's important not to feel guilty for whatever it is you're dealing with. It's okay to say no to family if you don't want to do a family gathering. It's okay to just say, I'm gonna sit, I'm gonna sit at home and I'm not going to go to that. And so I think it's important that we understand that we're dealing with a lot. And even though some might not understand us because they look at us on the outside and think, oh, they're fine. They look fine. They must be fine. That's always a good education topic there that you can say, well, actually, here's the thing. We all don't look like the cancer patient on TV. I mean, we're still sick. So I think sometimes we just have to educate others about especially our family, how we're feeling, and say no and not feel guilty about it. I'm rambling.
No, it
You
100%.
gotta reel me in.
No, no, I think that was really well said. I'm glad you shared that, Ashley. You know, so I'd like to give the opportunity in the last segment too for us to dive a little deeper into that. But first, this targeted therapy with Tagrisso, you know, or osir, let's see, I don't want to butcher it, osimertinib. I've been telling people and like talking to doctors and saying, can we like redo the way that we like name
I
these
don't know,
drugs?
why does it have to look like a scientific name of
That's right.
an insect.
That's right. That's right. So the FDA had actually just approved, this is 2017. So the FDA had just approved Tagrisso for specifically, EGFR positive non-small cell lung cancer, also with the T790 mutation. And it had said, though, also in the very initial stages, like in March, for instance, that you had to have been on one other line of therapy. So you were brand new on this drug. I mean, just can you describe that experience and what that was like?
Well, when my doctor called and said, this is what we're doing. You had your EGFR, you have the T790, you need to be on Tagrisso. I'm gonna call this in, or send it up to the CVS specialty pharmacy. And they came back with a decline, not approved. And so I'm like, what? You know, I had no clue of any of this or how it all works. So I'm on the phone with the secretary, and literally, she and I talked so much. She's like, I'm going to invite you over for Thanksgiving dinner. I mean, that's how much we talked back and forth. And so it was a lot. I was writing letters, they were writing letters. And thankfully, I had a person that is a very close friend that also works in oncology, and her doctor that she worked for prescribed Tagrisso, and she's like, no, it is just released first line, FDA. They don't have, the insurance companies don't have the update because it is that new. And so I got on the computer and I Googled it. I found an article. I printed the article out. I put it in with my letter. And my husband thought to call the manufacturer. He's like, let's just call AstraZeneca, see if they can help us. And he did. He called, and of course, they wanted to speak with me. So I talked to them, and they confirmed, yes, it is, has been approved. It was like September-ish, I forget the date, but it was within days, a month at most, that it had been released for a first line. And so the lady at AstraZeneca was like, no, that's incorrect. The insurance companies don't even have the addendum yet because it's that new. Apparently, they're later and they're updating. And so, phone calls to AstraZeneca, to the insurance companies, to the pharmacy, like it was just, that was my full-time job for about 48 hours. And so I wrote the letter, I printed out the article, sent it back to the insurance company. My doctor wrote a letter. AstraZeneca said they would be happy to write a letter. It didn't come to that. They did their own research and approved it. But in the meantime, AstraZeneca understood where I was and where I was sitting, and that I was a brand new cancer patient. I needed to start my treatment. And so they put a starter of 15 pills in the mail, overnighted to me, and I started that very next day. And so I was like, well, what if I go beyond 15 days? Will I be able to get some more? She's like, yes. And so it was absolutely, like I said, free of charge, that they were able to help me, and everything worked out within about a week. So that was an amazing experience. Frustrating, to say the least, because I'm blind. I'd only ever had an antibiotic for a sinus infection or, upper respiratory something. So I thought, okay, the doctor sends in the prescription and you go get it. Like, what's there to approve? And so there was really a lot of red tape to have to go through just to get in some sort of survival mode. Here's this cancer growing in my body, It's been almost a month now. I need to fight this stuff. And I'm just walking around like, woo. And so I was thankful. I was nervous to be able to start the drug because I thought, oh, I'm gonna, what's gonna happen to me? Am I gonna start throwing up, within 30 minutes? Am I gonna be able to hold it down? Because a lot of people can't. A lot of people on Tagrisso, I'm in a Tagrisso group on Facebook, and we bounce, have you had this happen? Have you had that happen? And a lot of people can't, like, they couldn't even hold it down. They would throw it up. And so thankfully my body accepted it, because there's many out there that it won't, their bodies don't like it and they have to do something else. So it's a really awesome, incredible, life preserving drug, and we can thank cutting edge research for that. For sure. And hopefully there'll be something next when I need something next, similar to what I'm currently on for EGFR resistance.
That's incredible. And by the way, on that note, just in December of 2020, the FDA did approve Tagrisso for earlier stages of lung cancer,
Yeah.
with the EGFR positive. So, for people who I guess have gone through the surgery, and then they take it. And so, like you said, it's the research that allows this to happen and hopefully can continue on, so that more people have this option. I do want to shift over. I have one last question though, in terms of the monitoring. So how often, so I know you're taking the pill every day. How often are you checking in with your oncologist? I know COVID kind of changes some protocols sometimes with the virtual telemedicine instead of in person, but yeah, how often are you seeing him?
I go every 2 months for blood work, and it's my blood work is fine every single time, which is another thing to be thankful for, because so many have to come off of their chemo, because of different blood counts, lower blood counts or whatnot. And then I have scans every 4 months. I was doing every 3, but we got pushed out to 4 months just to not risk getting any sort of like radiation poisoning. And everything has been stable since. I do CT scans. I don't do PET scans. I just do head, neck, basically full body CT with and without contrast, head, neck, chest, abdomen, pelvis. So when they get me, they're like, we're scanning all of you. And I'm like, yep. And so, now I've developed like relationships with the techs and with the nurses, and they're like, oh, hey, so I'm a frequent flyer. And sometimes they change out and I won't know who's there, but normally, it's the same people. So they've like become my family and I'm kind of there, so they're like, it's been 4 months already. And I'm like, yeah, it has. And so I'm like, wink at me if it's okay. But luckily I get same day results. So many of my friends that I connected with in the lung cancer community have to wait days for their results. And I would lose my mind. Obviously, if that's my only option, that's my only option. But, if I go get a scan at 7:30 in the morning, by 9, I'm sitting in the doctor's office getting the results. So I'm super grateful for that because, like I said, so many have to wait a week or more just to know. And we all have scan anxiety. And so just going and then knowing that it's done, but you don't know what it said, it's like, how long can it take? But, in bigger cities, there's so many people and they're just inundated with patients right now. So I'm thankful that I'm in a smaller community and that is an option for me. for
And
sure.
that is weighing sometimes between larger places and smaller. It's like you might get more attention or personal interaction at the smaller place. So there's always things to balance there. But Ashley, thank you for taking us through all of that. We're going to shift now to your last segment, segment three, on living with cancer.